We have just heard Prime Minister Modi's speech on GST reforms, which are going to come into action from tomorrow, 22nd of September. And in this festive season, we really welcome the institution of these reforms. Especially, it seems that the healthcare sector, the patient, the general public has been kept in great view while these reforms have been instituted. Primary among them is that on both health insurance and life insurance, GST, which used to be charged at 18%, has been brought to 0%. This will give a huge fillip to health insurance, which was very expensive. And now with 18% GST becoming zero, it will become much more affordable. And many millions of more of our citizens will go into the healthcare insurance. And that is the only way that we will be able to provide both access as well as affordability. Because without insurance, when a person used to pay out of pocket, at times it was very difficult for them, and they had to run from pillar to post to be able to make that payment. Similarly, medical equipment and other diagnostic kits, other things which are used in a hospital, disposables, all of them have been brought down from 12 or 18% to 5%. This also will make these equipments much more affordable, and even small nursing homes, which are 10-bed, 12-bed, can get more of these equipments so as to help people in the peripheral parts of our country, in the rural areas, in Tier 3, Tier 4 towns and cities. Another major change that has been brought about is that many cancer drugs, which are very expensive and which used to be in 12 or 18%, have been made exempt from GST. They've been brought into 0% GST, making them much more affordable for the general public. Similarly, if we see drugs for rare diseases, which again are very expensive, have also been exempted. And most medicines, which over the counter or which are through a prescription, have been brought to 5% from 12 and 18%. This, I think, is a huge thing that has been done. And with medicines, as it is, India is the pharmacy of the world, and generic, high-end and high-quality generic medicines are made here. Bringing them into 5% or 0% will make them much more affordable to citizens of our country. And finally, I would say that even exercise equipment, gym equipment, even the charges that are charged by wellness centers have been brought down to 5%. And this also will give a fillip to the fitness industry. Ultimately, it is all about wellness. Of course, when we fall sick, we have to go to a doctor, we have to go into a hospital in case it's a serious illness. But the focus from what we see, the changes in the GST regime for healthcare, will be on preventive care, will be on primary care. And that is essential, because we've heard since our school that prevention is better than cure. But let me say that prevention is also cheaper than cure. And if we can prevent illnesses, if we can pick up diseases early in their course, then not only do we get a cure, but also overall the money that is spent by the country on healthcare also will be lesser. So congratulations to PM Modi, the Finance Ministry, his government, that the voice of the common man, the voice of the medical professional, the voice of the healthcare industry has been heard by them, and there may be a few things which have got left, but as Mr. Modi himself said, this reform is an ongoing process, and we will be interacting with the government to see that wherever we feel that some things have got left out, that should also be addressed, and that reform can come at a later date.